just want to go through just a few housekeeping items first. During the presentation tonight, we ask that you keep yourself muted until the end when we open it up to questions and discussion. If you have any questions that come up during the presentations, please feel free to use the chat either privately, so you can choose who you want to send to. You'll send it just to the presenter, or you can, if it's a less specific question, you can just send the message in a chat to everyone. At the end, we'll be answering all of your questions. So without any further waiting, I'm going to hand this over to Dr. Monica Maroney and Dr. Brittany Igwicki, and they're from Shorewood Family Chiropractic, and so they are going to be presenting for us first. Okay. Okay.
Having a little technical difficulties getting up the PowerPoint. Okay, so I had to give us a minute.
Here we go.
There we go.
Okay. Hi, I'm Dr. Brittany, and I'm a chiropractor at Shorewood Family Chiropractic, and I'm here with Dr. Monica Maroney, and we're going to be talking today about headaches and the benefit of chiropractic care. So 9 out of 10 Americans suffer from headaches, and almost half of all of adults have had at least one headache in the last year. And just in general, headaches across the board are more common in women. There are about 17 different types of headaches, but today we're gonna focus on these last 3. So the tension headache, migraines, as well as neck headaches, or what we like to call cervicogenic headaches. So as you can see in these illustrations, the tension headache is typically a band of pain that causes squeezing of the head. Migraines are typically felt on one side of the head and may be accompanied with nausea or visual changes. And then the neck or the cervicogenic headache, the pain is typically felt at the top or the back of the head. So we're going to go into a little bit more depth of each of these headaches. So the tension headache, again, is a band of dull pressure or squeezing pain around your entire head. It typically starts at the back of the head and spreads forward. Typically, these headaches start later in the day. The pain or pressure is usually mild to moderate, and they affect both sides of your head equally. A lot of times you may actually get soreness or tightness in the muscles in your neck, shoulders, or jaw as well. Migraines affect about 28 million women in the United States. 85% of chronic migraine sufferers are women, and roughly 1 in 4 women will experience a migraine in their lives. And migraines are typically a one-sided pain that is described as throbbing. Often the pain is felt behind one of the eyes. Typically, these headaches will last anywhere between 4 to 72 hours, and they may be accompanied with nausea or sensitivity to light or sound. 75% of migraine sufferers have actually reported neck pain during an episode as well. Now for the neck headaches, which we call cervicogenic headaches, the International Headache Society actually has the official definition as pain referred from a source in the neck and perceived in one or more regions of the head or the face. So basically, it's one-sided pain that will start in the neck and is often brought on or increased with head or neck activity. Typically, you will see a reduced range of motion in the neck as well. And again, these headaches are more common in women. So the majority of headaches are actually caused by problems in the cervical region of the spine, also known as the neck. Vertebrae of the cervical spine can become misaligned because of excessive or repetitive stress. And these misalignments are what we like to call vertebral subluxations. So if you look down here, this would be a subluxated vertebrae, and often that causes irritation in the nerves of the neck, as well as excessive muscle tension, which can then lead to a wide variety of headaches. And according to the Canadian Family Physician, over 70% of headaches actually arise from problems in the cervical spine and its related structures. So as we can see in this illustration, the difference between an aligned cervical spine in comparison to a misaligned cervical spine in which there's a vertebral subluxation. Obviously, this can cause muscular imbalances and can contribute to tension and some of these headaches as well. Also, I'd like to mention in the neck, if that is misaligned, that can also carry down and cause other misalignments in the body as well, and just throw other things off. If we're going to focus specifically on the muscles and the tension, these three are some typical muscles that are usually associated with some of these headaches. And looking at the sternocleidomastoid, also known as the SCM, you will see these white X's in the illustration. These are the trigger points in the muscles. And a lot of times those trigger points will actually refer pain into the head, which you will see as these little red dots. And that is the areas where the patient will typically feel the pain in the head, but it might actually be caused from the neck. And I'm going to turn it over now to Dr. Monica Maroney.
Okay, so all headaches tend to have general triggers, no matter what type of headache that it is. So for example, stress is kind of a universal trigger for everybody, and whatever type of headache they may be susceptible to, when there's more stress, things tend to be worse. So these are just typical mom stresses or women stresses, you know, childcare, working, nursing, carrying, cooking, laundry, all these things that can be kind of straining, could increase or make headaches be more often. Hormones is another really common trigger that may be unique to women. Lots of my patients come in and say they get bad headaches one time a month. That type of thing is almost always hormonally triggered. So that's another important factor that may need to be addressed for somebody. So posture and people's lifestyle can be very important also, especially for the tension headaches that could be triggered by the tightness in the neck, the upper back, the shoulders. So this is something that we see quite a bit of now, especially with the younger kids and the teenagers. Many of them are on their phones all day or on a computer, especially now that they're all home doing school online. They'll do homework on their phone. They'll do it on the computer all day. And what happens is oftentimes their head starts to come very forward, and that puts a lot of extra strain on the muscles in the upper back and neck. That's something that I see all the time, and it can turn into really, really a lot of pain for anybody, any age. This is another example of something that could be a trigger. So trauma. It could be something that's a big trauma, like a motor vehicle accident, so a macro trauma, or it could be the posture that can be repetitive, like a micro trauma, and that could happen repeatedly over time. People may get headaches, though, after they're in a car accident, and they might not realize that that accident might be what triggered the headaches in the first place. Okay, so going into a little bit of like a standard medical treatment for headaches, oftentimes is a medication. Different pain pills or even just over-the-counter NSAIDs will often be what people go to first. but many times they don't really fix the problem. They may just be a little Band-Aid or give some temporary relief. Sometimes though, they could actually make it worse. It's not uncommon that if people use like over-the-counter painkillers or medication repeatedly day after day for their headaches, they basically stop working. And then what can happen is they can get what's called rebound headaches. And then those are usually very frustrating for people because they take their painkillers, they don't work, headaches get worse, and they don't really know what to do, and they get very frustrated. So chiropractic treatment is just one option that could be utilized. We do manipulations, stretching. We can also do some nutritional or supplement advice or help people get that sorted out. A lot of times that can help some of those underlying hormonal issues. So the manipulation is our best tool. It's pretty fast and efficient, and most people get actually quite a bit of relief for tension or pressure that they feel in the head or neck area. And then these modalities also can be used in our office, or I often refer out to physical therapy for extra modalities if people need more work in the muscles than what we're sort of capable of doing with time in our office. And these are just, a TENS unit would be something that people would use at home, and I've had a lot of people asking me about those lately because they're fairly inexpensive. So that's like a fairly safe home treatment that people can use. So massage, stretching, mobilizing the joints. Again, these things can be done either in chiropractic office, physical therapy office, possibly a massage therapist office. Those tend to be all, I think, really effective for the muscle tension headaches or like the trigger point headaches that you saw with that chart. And sometimes what happens is people have overlapping headaches. They may have muscle tension headaches. Sometimes they might turn into migraines. And if you take away some of the trigger of the muscle tension or tightness, a lot of times it makes their other headache episodes also better. So home stretching can be a great thing to do, especially for some of the like posturally triggered headaches that come on the late afternoon when people are sitting or straining at their desk all day. It can put a lot of tension and tightness in those upper back and neck muscles. And sometimes just even moving around can help take the edge off the headaches. And it helps if people figure out or learn that some of the headaches may be coming from the base of their neck or in their upper shoulders, because then they have an area that they can focus on at home when they either get the headache or when they feel a little bit starting. And a lot of times they can keep the headache from becoming real severe. So these would just be typical things that we might work with also in our office, helping people figure out how they can do their ergonomic setup so that they have the least amount of strain. This is something that in the past few months, people have been coming in constantly complaining of their work from home setup, and they're just having a really hard time getting things ergonomic. So that's kind of, unfortunately right now, something that's a little worse for people. So pillows, sleeping position, this could also be something that might trigger extra muscle tension in there, or just help keep the whole spine and the head and neck aligned so that people might wake up in the morning with less tension. Occasionally, if people do things like clench their jaw at night, or like grind their teeth, they may wake up with bad headaches. And sometimes switching the position might help decrease that a little bit. Okay, so this is just a quick slide on, changing the diet. Usually people feel better when they eat better. So helping people remind what foods might be good choices. The other thing with headaches, some people have very specific triggers. Mostly migraine people will be familiar with certain wines or cheeses, things that they know they can't have because it always gives them a headache. Even certain people with food sensitivities or allergies, those might trigger headaches for them. Okay, this was just a little case study that we put in at the end here. So sometimes people can have extra symptoms with their headaches, and those might be alarming for them. If they have like blurry vision or the lights get a little bit off, the nausea, the vomiting. So those typically are more associated with the migraine headaches. Although, like I said, sometimes people do have overlapping headaches. This particular person did undergo chiropractic spinal manipulation and had a great results. She was able to stop taking her medication. So she probably had a pretty strong component of the cervical spine being part of the trigger for her headaches. Usually when you have pretty quick and easy success stories like that, that's how it goes. There is, though, often lots of times you can get people to be able to take less of their medication as the headaches get better. So that's always positive. Okay, so that is pretty much what we had. So we'll kind of go back to mute, and then we can answer any questions if anybody has it at the end after everybody's done their presentation.
Perfect, thank you. I am just adding a few more people that came in, and then I'm going to switch it over to Kayla from Serenity Health Care Center. Okay, and here we go, Kayla.
Okay. Oh, it's right there. Okay, I'm Kayla from Serenity Health Care Center. Today we'll be talking about breast thermography and kind of full body thermography in general. So some of you may know what that is, some of you may not. So what is thermography? Thermography is non-invasive diagnostic tool that we can use that will show changes in the skin surface temperature. So it converts infrared radiation that's emitted from our skin surface into electrical impulses that are visualized in color on a monitor. In a few slides, we'll kind of show you what all that wording means. So the image graphically shows maps of body temperature. The spectrum of colors indicate an increase or a decrease in the amount of infrared radiation being emitted from our body surface. It's correlated of temperature recordings with various conditions from disease, injury, as it relates to that autonomic function. Can tell us physiological changes, not structural. So it can show up to 5 millimeters dermal depths. So pretty much through that whole part of the body there. What can we use thermography for? So it can tell us different things related to vascular, muscle, neural, skeletal, can really look at the whole lymphatic system, the myofascial system, can define the extent of lesions of which a diagnosis has previously been made, can localize an abnormal area that hasn't been identified maybe by other testing options. They will still always recommend further diagnostic testing depending on what those findings are. What's great about thermography is it's a wonderful early detection tool. And we can monitor the healing process. Even with the chiropractic care, looking at some of those things that you guys were talking about and working with, you may be able to see some of those changes of what you're doing with your adjustments with the thermography as well. So what we use it for: breast health, adrenal dysfunction, injuries, oncology, can do it in pediatrics, thyroid, allergies, fibromyalgia, those trigger points, arthritis, inflammation, stroke screenings, nutritional disease. Lately, I've had quite a few come back confirming our Lyme patients that what they're seeing within their thermography is confirming that the immune system isn't functioning like it should. So what can it tell us, especially related to the breast? It can tell us if there's fibrocystic activity going on, lymph congestion. With a mammogram, we can't see those things. A mammogram is wonderful and has its place. What thermography is great for is that early detection and to make sure our breasts are healthy. Because if they're congested in that lymph system or our myofascial system's inflamed, our breasts aren't necessarily healthy, and that can cause a lot of other issues to happen. They can tell us if a woman is more estrogen dominant in her breast, can tell cell changes 8 years earlier than a mammogram can, which is huge. So screening thermography has the opportunity to detect changes at any stage in the development from the first year through to when a tumor is dense enough to be seen with a mammogram. This early detection of change can lead to earlier diagnosis and better treatment options, as well as the opportunity for patients and their healthcare practitioner to intervene at an early stage with preventative treatment, and can tell us that those atypical precancerous cells. So here are some pictures to kind of show you what that looks like. Before I kind of go into that, there are different thermography cameras. The best one, I think, is the one that we use. It's through a company called MediTherm. They've been around for a very long time. What makes them stand out from a lot of the rest is they provide us with certified MDs to read these images. So it's not me as the tech, it's not anyone else that's actually taking your images, telling you what's going on in that scan. They're being sent to certified MDs to read them. So they have to be an MD and they have to have 8 years of training on top of that degree to read these thermographies on their own. So if you kind of look on the normal breast picture here, it's very symmetrical. Both breasts look pretty similar to one another, even kind of up under the arms. They look at the color as well as the different patterns that present itself. So white, where you can kind of see under here, is your hottest temperature, goes to reds, oranges, yellows, greens, blue as being the coldest temperature. Different patterns mean different things at different depths of the body, or however those characteristics are of that pattern also tells them different things as well. So here you can kind of see a lot of inflammation in the breast. This is breast cancer here. So you can kind of see how it's not very shaped, very symmetrical from one side to the other. Here's estrogen dominant. It's very inflamed, very hot in the breast here. This in this spot on the back here shows immune dysfunction. This one here is male breast cancer, so you can see where the differences are from one side of the body to the other. So here they have a lot of inflammation. And this is someone who's presenting with a lot of shoulder pain. You can definitely see from one side of the body to the other how different that really is showing us. So here is a normal breast, and here's abnormal. So again, kind of that normal symmetry of the breast. This is vascular activity in the breast. You can kind of almost see that working in there. Again, some more inflammatory breast disease here. Again, the male cancer. This is that ductal of the left breast. So this is just kind of telling you that it detects subtle physiological changes that accompany breast pathology, whether it's cancer or fibrocystic disease, infection, or vascular disease. Doctors can then plan accordingly, lay out a careful program to further diagnose or monitor until other standard testing becomes positive. This allows for that earliest possible treatment. So if somebody comes in and we do an initial breast thermography, We can have results back on an urgent basis where we will have them within 24 hours, or usually it takes them between 1 to 3 days. At the most, I've seen it take a week or so during kind of that September, October range, where a lot of women are starting to kind of do their yearly breast scans. They will tell you what's going on that initial scan, but they will also recommend a 3-month follow-up scan as well. So that way, if cells change, they do that in a 90-day increment. So that's why they want to capture what that breast looks like in 90 days to make sure that's what you kind of look like and what your baseline is. Make sure those cells have not changed at all. And then depending on your history and things like that, they may recommend you come in yearly, or they may say every 2 years. Just kind of depends on that history and that situation. So here is breast cancer detection using thermography and ultrasound. So here is the area that they were looking at that they ultrasound. So you can see kind of that difference there. They will always tell you if there's anything abnormal in your breast scan. I've had a woman come in to do a breast thermography, and the area in her neck had this big white line down it here. So I took some additional images. It made me a little concerned. I haven't seen that much before. And it came back that she had elevated CRP levels and inflammation in the carotid artery. And we ended up then ordering an ultrasound of the carotid artery, and it was almost 90% blocked with no symptoms. She had not a single symptom. And if she didn't do that at that time, unfortunately, she wouldn't have known that was happening until something worse happened or she had symptoms. So again, this is the fibrocystic changes in the left breast, more of that ductal carcinoma here. So you can definitely see the difference there. And then again with that inflammatory cancer. So this is showing us some heart disease. This is a pre-stroke patient. So that patient that came in with that carotid artery that was almost fully blocked, there was a giant white straight line right here in the neck. Here's inflammation in that shoulder. Here's some carpal tunnel. A lot of patients that we see have Lyme's disease or other chronic illnesses, and their hands here very rarely show full hands. So they're that cold where you can kind of see the tip of the ear is black here, where the fingertips will just not be in the image because they are that cold. Where chiropractic care, I think, could probably help with that tremendously, and maybe there's something blocked in there, or try to get that circulation moving like it should, so then other practices can come into play. Here is some periodontal information. Here is a nice little chart on tumors and other diseases and how those cells change and how rapid they do change. So in 90 days, there'd be 2 cells. In a year, there'd be 16. 2 years now, there's 256 cells, the size of a grain of rice, which is now detectable by thermography. You're not going to see cells in a mammogram until you're way over here in 7 years with this many cells. So this is a great tool to use with a mammogram. With thermography, they'll be able to tell you where it is. They're very careful on exactly what, because that's where a mammogram is going to come in to really look at that tumor and say, what is it structurally? What type of cancer? What's nice about thermography as well is it can see through very dense tissue. I've seen a lot of women who have very dense fibrocystic breasts, and the mammograms are very painful, and it can't see through that density. So then every 6 months, they have to have a mammogram, a lot of radiation, a lot of torque pressure on the breast. So if there are cancerous cells, you've added radiation and you've squished that breast and are able to break those cells because it has that much torque pressure on the breast. So this is a nice way to use with it, where nothing touches you. There's no pain, nothing touches you, there's no radiation with thermography. So what to expect at your appointment: completely radiation-free, completely pain-free, nothing touches you. So you come into the office, we'll call you back into an exam room. We give you a very nice, comfortable cloth robe, so you don't have to be in one of those uncomfortable paper ones at all. And it'd be either myself or my team member, Colleen, that you would see. And if you're just doing a breast thermography, there are 5 different positions. We kind of looked at those a little bit earlier. You will get undressed from the waist up. You won't be able to put any lotion or perfume on, no deodorant. Try not to have people like use a sauna the day of or do crazy exercise right before you do that. And then you will sit on a stool, and there's those 5 positions. So everything for the breast part would be with your arms up as high as you can. And you'll do face on, one of each side of the breast, and then it'll have half angle. So if somebody had breast cancer previously, and so they've had a breast removed, or they have implants and they have scarring or things like that, we will mark those areas, maybe have you hold a pen to where that scarring is specifically. We'll take a detailed history of all that information so they can take that into consideration when they're reviewing your images as well. For full body, it can look at absolutely everything in the body except the brain and the genitals. The brain is its own complex being. The genitals are just simply too hot. So you can't get them to cool down enough to be able to take those images and read those areas. So these are those 5 images of just the breast part that you would do. For the full body, you would be undressed completely. We do allow you to leave your underwear on. The best option is to wear like a thong kind of underwear, or try to make it so we can see that buttocks very well and the hips very well, especially if you're having hip pain. If you wear underwear that are kind of more high-rise, kind of closer to the belly button, we'll have you pull those down as low as you can so we can see everything in the abdomen, make sure we can get everything that we can imaged. In the reports, they are very thorough, and they kind of break it down for a full body by section of the body. So they will do like head and neck, upper extremities, lower extremities, abdomen, back, all of that sort of thing. If they find something that is questionable, they will make a recommendation for further testing, whether if that's an ultrasound or a mammogram or an x-ray. They will actually put that in the exact report. Usually the reports are where you don't need a PhD to understand what they're saying. Some stuff is where you do want a physician to go over that with you and explain some of those things to you. Depending on your physician, they may accept the thermography, they may not. So it just kind of depends on your provider there. So we are offering 15% off any thermography, whether if that's full body or just the breast. If you call and schedule with us, just mention the word freedom, and then we will give you 15% off any full body thermography or breast thermography. If I remember, the initial thermography is like $175, and I think a full body is $275. So here's our kind of contact information, and I'm happy to answer any questions you guys may have. Thank you.
Thank you, Kayla. And then our last presenter for the night is Nina Olson. She is our women's health specialist at Freedom Physical Therapy Services.
Okay, hello. Just pulling up my PowerPoint. Okay, thank you, everybody. So we're going to be talking about now diastasis rectus abdominis. And just a reminder, we are here from Freedom, and myself and Diane here at our Fox Point Clinic. And we have other therapists that also treat this condition, Ann in Grafton and Tracy in Brookfield. And we do have one more location in Mukwonago. So today we're going to talk about diastasis rectus abdominis. So we're going to define that, talk about how common it is, what research is saying about this condition, and what can you do about it if you have it. And we'll also debunk some myths that I hear often in the clinic. Okay, so diastasis rectus abdominis. So what is it? It's abbreviated DRA. Sometimes you hear DRA, diastasis recti. What that is it's a separation of your six-pack ab muscles. So if you can see my cursor here, we've got our six-pack abs, and those muscles are connected with connective tissue right down the center called your linea alba. And with the diastasis, this linea alba, this connective tissue that connects both of those muscles, has become overstretched, and we determine if this is a diastasis by measuring how big that linea alba is. So if it's greater than 2.2 centimeters or 2 finger breadths wide, it is clinically significant. Okay. So that linea alba, when it becomes overstretched, it's like overstretching saran wrap. And how saran wrap can get kind of wrinkly, it just doesn't go quite back to its same normal tension. That's what happens with the diastasis, and often this happens during pregnancy. Okay. This is what it looks like on a person. So these are cross sections of the body. So if we look at the top picture here, we can see we're looking right directly down the center of somebody. So we've cut somebody here, and we're looking down into their insides. And we can see that we have these rectus abdominis muscles. The red here are the muscles, separated by the linea alba, connective tissue in the center. And that's like if you're, using or cleaning chicken or using raw meat to cook, that white connective tissue. That's what we're talking about here. It's kind of shiny and slippery. That is the connective tissue that separates these two muscle bellies. And then when we have somebody with diastasis recti, this is what their abdomen looks like. So we have this muscle here, one side of the rectus abdominis, the other side, and we just have more tissue between here, overstretched tissue, and this results in a bulge in the center of us. Okay. So how prevalent is DRA? Well, all women have a variable amount of separation by 35 weeks of pregnancy. So everyone has something happening separating their abdominal wall when they're pregnant. And that typically occurs and recovers by 1 year post-delivery. But we have a study in 2014 that showed that 40% of women remain separated for unknown reasons. So about 40% of women who have had children have a persistent DRA. Men are not immune to this condition. They can also have this. It's just not quite as common as in women. I get asked this a lot. Is this preventable? Well, we have a research study in 2014 that looked at this very question, trying to figure out why do some women have this postpartum and some heal completely on their own. And they looked at a number of factors. They looked at the pre-pregnancy BMI, so their body mass index, which is their height to weight ratio. They looked at what they were like pre-pregnancy. They looked at women at 6 months postpartum. They looked at how much weight they gained during their pregnancy, how big their babies were, and their general hypermobility. So if they can do splits, if they can pull their thumb back to their wrist easily. They looked at all of those factors, and they determined that none of those factors had any correlation to whether or not somebody remained separated in the abdominal wall at 6 months postpartum. So the answer is no. We really don't know if we can prevent it at this point in time. So how do we measure DRA? So in the clinic, we can measure it for you, but there's a way you can measure it at home. So if you would like to do this now, you can. You can lie on the ground, and what you're going to do is you're going to put your fingers at the center of your abdomen, and I find it easiest to start right at your belly button. So you're going to put your fingers perpendicular to the ground, so they're pointing straight down into the ground or towards your abdomen. And you're going to lift your head up, like in this second picture here, leaving your shoulders on the ground. And you're going to find how much distance there is between the two muscle bellies of the rectus. So you'll feel those muscle bellies kind of bulge out, and find that distance between the two. If you can get 2 finger widths or more, that's clinically significant. And how easily does that sink down towards the center of you? If you can press all the way down and feel like you're touching your insides, that is also clinically significant, okay? So we can measure that all the way from the top of your breastbone down towards your pubic bone. So symptoms that often present with this condition, not necessarily caused by, but we can't say that because the research hasn't told us that yet. But we know that often we see these problems coexist with diastasis recti. Most often clinically, we see low back pain. We can see thoracic pain and neck pain. Pelvic pain, so here is the pelvis here. Anywhere along the pelvis we can have pain that coexists. At the pubic bone here or back here at the what's called the SI joints, so where the spine and the pelvis meet in the back. Often we see a correlation with urinary incontinence, so any sort of leakage of urine that we don't want, that coexists with the DRA, as well as pelvic organ prolapse, which is the internal organs pushing down into a weakened vaginal wall, or the rectum itself coming out. So you can see down in these pictures here, this is the bladder pushing down into the vaginal canal, the rectal rectum pushing down in the vaginal canal, or even the uterus just coming straight down. So that's a lot of things. So why so many things related to a diastasis? Well, the big takeaway is that we know this now through research, is that when there is a diastasis present, that our core and abdomen is not working effectively, okay? So our core and abdomen is supposed to stabilize our spine and pelvis when we do activities in our life. So if we're exercising, if we're picking up a bag of groceries, we should be transferring force from what we're picking up through our abdomen. And when we have a DRA or a diastasis, that is not happening. And we have compensation strategies that, a lot of times appear, and that puts increased stress in our bones and joints of our back and pelvis, and even our pelvic floor muscles. So what can we do about this? So in order to really talk about what we can do about this, we need to have a better understanding of the core muscles. So we have the core here, okay? So we hear the word core a lot, but I wanted to define what that really is. So in research, core is defined as the 4 muscles of our anticipatory core. That means when we go to reach our arm up above our head to grab something out of a cabinet, or if we go to take a step, our core fires first before we even move our arm, or even before we move our leg. So the muscles that make up that core are these 4. So our diaphragm, which sits here underneath the lungs, multifidus, which are muscles that sit right along the spine, our pelvic floor, which is from our tailbone to our pubic bone, and the transverse abdominis, which is a deep layer of abdominal tissue that goes around our abdomen like a corset. Okay, so the main goal of those muscles are to stabilize our trunk and stabilize our pelvis. So let's zero in on one of these muscles here called the transverse abdominis. Okay, So the transverse abdominis, that is like a corset that goes all the way around our abdomen, and it's deep in our abdomen. So the important thing to know here is that when this muscle fires, it can actually create tension in that linea alba, which is where the diastasis occurs. So if we have that wrinkly tissue, that overstretched tissue right in the center of our abdomen that's not supporting our spine, this muscle can actually draw that area tight and taut and provide stability. Okay. So transverse abdominis, really important here. Here is an example of what it's like to contract your muscle. Okay, so it's a deep muscle of our core, so it's not as easy to know if we're contracting it. Just like if we were contracting our bicep, we could see our arm move. This is what happens when we contract our transverse abdominis. So here we have a relaxed abdomen. And here, when we contract our transverse abdominis, it's like a corset. It draws that abdomen up and in, and it creates tension in that overstretched tissue of the diastasis, where the linea alba is. Okay. So again, research is telling us this. Okay, so we thought this was happening for a while, and now we're having the research that is backing this up. And it's telling us that if we contract that transverse abdominis, that corset muscle, we have better force moving through our body from side to side with movements. So that's a good thing. We have more stability in our spine when we contract the transverse abdominis, when we have that wrinkly tissue down the center. So here's what happens, we can see with real-time ultrasound. Okay, so real-time ultrasound is a tool that we use here in our clinic, and we can take a look at this. And this is a part of a research study here that I pulled up. And real-time ultrasound is just like if you had an ultrasound to look to see what the baby was looking like as you were pregnant. Here we're looking at the linea alba, or that tissue that separates your six-pack abs. And this is somebody who has a diastasis. Here's the actual picture, and here they just drew the outline of that so you could see it a little bit better. So you can see the muscle bellies here, separated by linea alba, and more muscle belly here. So that's at rest. When we have that person do a curl up, and they just do like a little mini sit up, and that works their six-pack abs, what happens is the muscles come closer together, and this tissue becomes actually more wrinkly. Okay? So it really didn't draw taut, it really didn't support our spine at all. When we have somebody do a transverse abdominis contraction, we fire that corset muscle, then they do a curl up, we actually see that we get tension in the linea alba, which supports our spine and pelvis. So that's good. We also know that if we load this muscle, or this tissue here, sorry, tissue, not muscle, that we get strengthening of that tissue. We get protein synthesis and regeneration. So all again, just showing us that using the transverse abdominis to stabilize our back is so important when we have a diastasis. So here's what it looks like in real life. So here's somebody with a diastasis, and we have that person do a curl up. So in this picture here, we did not tell them anything about firing that corset muscle. You can see what happens is that we have a dome shape happening here. Okay, so there's weakness in the center, that connective tissue is wrinkly, and we get that characteristic bulge or dome. You can see it even here from the side, doming happening here. But when we have that person do a transverse abdominis contraction, we have them fire their corset muscles, then do a curl up, we have no dome. So that drew that area taut and connected and supporting our spine and pelvis. So very important. Okay, so what can you do about your DRA if you have a diastasis? So the first thing we want to do is we want to avoid movements and exercises that result in that doming that we just saw. So if you recognize that, if you're in an exercise class and you say, that's exactly what's happening with my abdomen, we want to stop doing those exercises, okay? We want to listen to your body if movements or exercises cause pain. So a lot of times we have people come into the clinic and they say, you know, that they are doing their exercise program, and whenever they get done with their exercises, their back hurts, okay? So pain is really telling us that our body is not ready for the load that we're putting it under. So listen to your body. If you're able to engage your transverse abdominis correctly, so if you've already been trained in that and you know how to do that, start doing so while you exercise. So especially if you're doing Pilates or yoga, getting that transverse abdominis to help you will really support and stabilize your spine. We can use an exhale when you're lifting and use good body mechanics. So that's a nice little trick to help your transverse abdominis engage. So if you're picking up something from the ground, like a bag of groceries or a baby, anything like that, use your exhale as you stand up, and that will help your transverse abdominis kick in to support your spine. And consider PT to address abdominal support and your alignment, if you haven't done so already. So how does physical therapy help? So we address the alignment for better abdominal muscle firing. So addressing your alignment is really important in getting your muscles to fire correctly. And this is something that we can do with physical therapy, with chiropractic care. It's always nice when we're sharing patients with chiropractic care and physical therapy. To get that alignment work is going to allow your muscles to just kick in and fire much better. We can do manual therapy to release tissues that may be tight. So there might be tightness somewhere in your back or in your hips or in your viscera, your internal organs. There might be tension or tightness there that are actually pulling your diastasis further apart. So we can release those tissues to help get a little bit more stability in the front of you. We assist in improving tension in the linea alba by teaching you how to activate your transverse abdominis. So that's something that's really hard. There's a lot of cues out there, and we use different cues in the clinic to teach people how to activate their transverse abdominis. And a tool that we use here is, you can see this is from a training class with ultrasound. This ultrasound is showing us on this little screen back here the transverse abdominis. So we can use that as a tool to help somebody contract that muscle correctly. So we can see it right away on the screen that, yep, that was a really nice contraction, or no, let's try again with a different cue. We develop a training program. So we want to incorporate transverse abdominis training once we find what cueing works best for you. And we start to incorporate movements and activities that you want to return to or do in your daily life that are causing you pain. And we teach just generally better body mechanics, so your muscles can kick in much easier. So what's something you can start doing right now to help yourself with a diastasis? Well, something we can start doing right now is we can start lifting a little bit better. So if you find this is sometimes what you look like with lifting, okay, a rounded back, forward head kind of position, or maybe we're not bending in the legs at all, we're just putting all the stress on our back and spine. It makes it really hard for our transverse abdominis to kick in at all to help lift. But if we bend a little bit more like this, so we have a wide stance in her feet here, she's bending deeply in her hips and knees, her back is straight, her head's in good alignment, her head's not going way forward. Using her arms to keep the load close to her. And also at this point, when she's at the lowest part, she could use that exhale to stand up, and that would help kick in her transverse abdominis to provide more stability to her pelvis and spine. Another good example of bending and lifting. So myths. What are some myths that we hear often? I often hear that closing the gap is the most important thing, and we get really focused on trying to get those tissues to come together, or making sure that the finger breadths are going from 3 down to 2. Well, really what's most important is that we can have tension in the front of the abdomen. And even if we close the gap, if we have that wrinkly tissue that's not supporting, it's not doing a very good job of stabilizing our spine and pelvis. We want to be able to draw tension in the front of that abdomen. Some people say that they know that they're never supposed to do a plank or a curl up again. Well, I don't like to say that there's a blanket statement of an exercise that you just can't do anymore. So with proper training and watching to make sure that you're not doming that tissue in the front, we can definitely get back to planking and curl ups. Sometimes people think that surgery is the only option. Surgery is an option, and sometimes that is the best option for somebody. But we won't know that until we start training the abdomen and we see if we can develop some tension in the front of the abdomen. Sometimes that tissue has been so stretched that even with the proper training, we're not able to develop enough tension to stabilize your spine and pelvis. And then we talk about surgery as potentially a better option at that point. Sometimes people think they can only do light exercise, or since they have this split in the middle of them, that they should only be walking or very lightly jogging. But we can certainly get back to CrossFit and a lot of the exercises that people are anxious to get back to. We just have to train you to get there. And sometimes people think that they always just have to live with this back pain. And that's certainly not true. We know that through the research that if we do a good job of bringing some more tension to the front of the abdomen, we can stabilize that back and pelvis very nicely. So thank you. I have my email if you have personal questions that you would like to ask me after this.
Thank you, Nina. So now what we're going to do is just that if anybody has any specific questions or would like to ask any of our presenters any questions, we just ask that you guys just kind of take turns unmuting yourself, and we will have each of the providers respond.
I have a question. I have a question for Kayla. You're still on? I can't see everybody here. Hi, Kayla. Really interesting. I have not heard of thermography before for looking at breast health. So is there information about false positives at all? Or I'm sorry if I missed that part. I got cut out at the very beginning.
I haven't really seen anything on false positives. So when they put something in that report, they're very careful on their wording. So say there's myofascial in the back. They will tell you that they see inflammation and myofascial in what specific area, and they're pretty detailed about that. I've had them comment on different, like the vertebrae in the back, the different joints they'll comment on. I haven't really seen a whole lot on those false positives. On each report, when you get your report, there's probably, I think it's at least a page or 2 pages of how they read it and how they decide what that information is. So like what's normal, abnormal, so they give you a ton of that information in there too. The company we use is called Meditherm, like MEDITHERM. So they may have a little bit more information on their false positives there, but I haven't really seen that be a huge issue. So far, anyone that we've sent for ultrasounds of different things have come back with something.
Thank you.
You're welcome. I see one in here too about if it's covered by insurance. It's one of those things that, of course, insurance will not cover. You could try to bill it on your own to insurance, but they probably won't cover. I've had patients use like an HSA, like a health savings account, and that they've covered for that, but not actually billing to the insurance.
Great. Does anybody else have any other questions or anything? Okay, well, I have recorded the presentation, so if you want to watch it back or share it with a friend, we will have it available. And I thank everybody for coming tonight, and all of our presenters. I will send all of their information and contact information to you guys at the emails that you guys had submitted to get the link. So thank you for sharing your night with us. We appreciate you guys tuning in, and have a wonderful night.